Hello, Facebook, YouTube, Instagram. I think we're everywhere. Just checking, we're live. I'm on this afternoon to look at PRP. We're going to just do a live. Can you hear me? Just checking. Yeah. So we're just going to do a live. Hello, I'm here. So I've just finished clinic today and I wanted to jump on and talk about PRP, so platelet-rich plasma injections that we offer here in clinic. It's been something that many of you are like, what is this? What does it do? So I wanted to just kind of jump on, answer some questions. I'll be here to answer any questions that anybody has and go through what is it? What does it involve? What does it help with? Does it actually work? And all that stuff. So answer all your questions. And if you're watching this in replay, please feel free to still ask. We'll jump in. So hi, I can see there's quite a few there. Hi, Gemma. Right, so PRP stands for platelet-rich plasma. What is that? So let's go through. So inside your body, you have blood. You all know that. And inside your blood, you've got healing properties. So I want you to imagine you'll have done this at some time. You've fallen over, you've scraped your knee, right, and you've got a bit of a red sore knee and it's bled a little bit. And then you look down at it and within usually a few minutes, it kind of goes like this yellow stuff kind of comes out and it goes all kind of crispy yellow, yes? So that is your white blood cells within your blood basically coming and starting that healing process. What we're doing with platelet-rich plasma injections, inside your blood, you've got these healing properties, healing proteins, 20 proteins called your platelets. Now, essentially, these are the parts inside your blood that are amazing for healing. And what we are doing with PRP is we are getting those parts, we're using those parts specifically and putting them where your body needs them. And in simple terms, that's what we're doing. So we're creating the best environment to allow your body to heal from an injury or to help with recovery, to essentially reduce pain, to improve function. That's essentially what we're aiming to do. Now, does PRP actually work? Well, the research, honestly, is pretty rubbish. The research is terribly done on PRP. You'll not find great research papers out there, and there's quite a lot of reasons for that. So for research to be of good quality, it has to be rigorously done, right? So it has to have like same parameters, the same, all of these parts need to line up. And unfortunately, with the studies that have been done on PRP, there's just too many variables there to actually accurately say, yes, that works or not. But what I will say is the research coming out is promising. It's something that is minimally invasive. It's something that doesn't cost too much. It's the side effects of it are minimum to none. So we'll talk a wee bit about that as well today. So side effects and what it does and why you would use it. But research-wise, the research isn't great, but that's understandable because there isn't a set protocol for it. So I don't want to get too much into the kind of issues with research, but research has its place. The NICE guidelines, the National Institute for Clinical Excellence do, recognise it, they do approve it as used in the NHS in some circumstances, and it is something that is used widely. It's been used for many years, but a lot of people don't know about it. You might have heard of things like hair regeneration from using your platelets to skin regeneration, and that basically is the same mechanisms that they're using. They're just utilising those platelets in a different way. So we use, certainly in here in post-podiatry in Glasgow, we primarily use PRP for joint injections. Now, we will inject primarily knees, ankles, feet, and possibly, we wouldn't go up into the hip. You can't do the hip without going into a theatre. We wouldn't be do kind of gluteal or greater trochanter area, so kind of lateral hip. and maybe into the buttock, but that's as much as we would do in here. You might find in other clinics, physiotherapists would do rotator cuff tendons, these kind of things. So it's not unusual to find this in clinics. So we're taking a bit of your blood. Now, when you come in, that sounds horrific, but it's really not. It's quite simple. What we do in here is we use a little device. So getting your blood taken can be a wee bit, don't like it. We take 40 mils of your blood in here and we spin your blood twice. And we'll talk a wee bit about that and why. So when I was looking at bringing this into the Glasgow clinic, I looked at what research was out there, looked at what the best guidelines were, and different systems will utilize your blood in different ways. And this is where that's why the research isn't great quality, because there isn't a standard protocol. So what I did was I looked at the studies, all of the kind of studies that were out there, and what was, in terms of from the studies, what looked to be getting the best results, and spinning it twice seems to be where the big results are. So it takes longer. So a lot of clinics won't do that, and it's a bit harder to do with a closed system. So we'll talk about that as well. So there's different systems, different pharmaceutical companies will want to sell us these fancy closed systems that will spin the blood once and put the plasma in, but actually we really need to be spinning it twice to get the quality of the platelets, because it's the quality of the platelets going in. However, there's some research that shows injecting the white blood cells in can be beneficial as well. So it's not going to do you any harm. Essentially, what is great about PRP is that it's your own body's natural substance, right? So in here, we can do steroid injections, and we can also do a thing called Ostenel injections. Ostenel is basically hyaluronic acid. And steroid injections, I wouldn't be given to a patient lightly. So unless you were in a really, 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 really needed that, you're really, really sore, you tried everything else and the inflammation was there, then a steroid injection really can help. But steroid injections damage the tissue around it. It basically just damages everything around it. So it isn't a long-term solution, and in the long run can leave you worse off. So it's not something that I would do easily, but it has its place. It has its place in clinic, and can be very effective if you're in a big bout of acute pain. Hyaluronic acid, less destructive, less side effects than what a steroid injection would be. But again, it's an external, it's a foreign body going into your body. Ostenel injections can be great around the tendon. You wouldn't do a steroid injection, for example, on many tendons, especially not the Achilles tendon. You wouldn't be injecting around that. But with Ostenel, you could. So hyaluronic acid, you could, and it's great for almost providing a layer of glide, right? So when you've got a tendinopathy, they get stiff and hard and sore, and then that rubbing then causes this inflammation cascade. And an Ostenel injection can help with that. So it can reduce the inflammation because you're getting a much more smoother move, and really help get you out of pain. PRP is your body's own substance. So you're not going to have an allergic reaction to it because it's your own tissues, right? So the chances of you having an allergic reaction are none. Whereas with steroid and with hyaluronic acid, there is a risk of that because it's an external thing going into your body. It's a foreign body. Also, with any injection, so regardless of doing steroid or hyaluronic acid or PRP, the biggest risk really with PRP with any injection is the injection itself. So you're creating a portal of entry, so there's a risk of infection. In here, we work under clean guidelines, so we would thoroughly clean the area, and we usually use a lovely big, you kind of leave like with brown and stuff on you, it's like a big iodine all over you. So we do everything to mitigate that. But I mean, injections and stuff are things that we do on a daily basis. We use local anesthetic daily. It's really not a big deal. So the first thing that we would do with PRP is take your blood, right? So that can probably for some of you be like, oh, I don't like stuff like that. We use in here a little thing called vein finder, because a lot of people it's struggle to get blood taken, and you'll know who you are, so it can be quite dramatic for you. And we appreciated that. So I, a few months ago, went on and did my phlebotomy training so that I was qualified to take blood. And that was one of the big things, was that everybody's very different. So we invested in this little device here. This is a vein finder. So essentially, we place this on, and where we find the vein, and you'll see just there, I don't know if you can see that on there, you can see how it goes dark. So that's where the vein is, where it's dark. And essentially, I would just be getting in there with my wee tiny needle and extracting the blood out of there. So it's really great for identifying where the veins are. So rest assured, we're using some nice nifty technology to make the process just a wee bit less traumatic if you hate needles. So we take your blood and we use a fairly small needle. We use a wee butterfly needle, one of these wee things here. Everything's single use. And this is it's a 23 gauge. So it's not too small a gauge, but it's not too big a gauge. And that also is something that's really important for PRP, because if we use too small a gauge a needle, then we can lose the platelets actually in that process of extracting the blood. So that was another protocol that we also looked at to make sure that we're getting the best quality platelets. So we use a little needle, and then we use little vacuutators, and they fill up with your blood. Then we take your blood and we spin it. We put it in a thing called a centrifuge, and it basically is, it's just a thing that spins your blood. That's it. It's not anything fancy really. And what that does is it separates the red blood cells from the white blood cells. Your red blood cells are heavier than your white blood cells, so they will sink to the bottom. And then what it looks like, your white blood cells will sit on top of that. We then extract the white blood cells and we place them into another sterile vacuum and we spin them a second time. And what happens is your platelets sit heavier. So the bottom 1/4 of your white blood cells is all we use for your injection. We don't use the rest of it. And that's where it's a wee bit different to the rest. So we only use that platelet-rich plasma, which is the bottom 1/4 after the second spin. And what we do with a sterile needle, and we use, I don't know if you want to see a needle, just want to see a wee needle. Does that freak everybody out? So again, everything's single use. These are our needles here. And these are, just depending on where we're injecting will depend on the size of the needle and what we're doing. But they're not massive, okay? Not massive big needles. But if we're going into a knee, we'll probably need one that's a wee bit bigger. And thankfully, we've got the option to use local anaesthetic, so we can numb the area beforehand. However, again, research shows that not using local anaesthetic can sometimes get a better result. So if you're kind of afraid of pain and you don't want a bit of pain, so we'll numb you up. But if you're okay with just a wee sharp jag, it really is over with very quickly. So it would be better to do it without a local anaesthetic. One, you're not putting something foreign into your body. Two, less likely to have an allergic reaction to the local anaesthetic. And three, it's two jags, isn't it? A jag for the local anaesthetic, then another jag. I don't know, just get one jag. So we can numb you up if that's something you're a wee bit frightened of. Another thing we could use is just something like an Elma cream. We can put that on the skin, just so that the actual initial prick of the injection doesn't give you the fear. So there's wee things like that. But honestly, it's fairly minimally invasive. There's no real, hi Rebecca, there's no real risks apart from the injection itself with PRP. What is it good for? So research at the minute is showing that it is excellent for knees, right? So knees, osteoarthritic knees, but also soft tissue injuries. So, and also tendons. So it's showing excellent results for patients who have arthritic changes in their knees. Now, there's many that will say that PRP will regenerate your cartilage and regenerate joints. That's a big statement to make. I don't think there's anything really that can do that. But again, there isn't enough research on that. There's many patients that when you inject them with PRP, they immediately feel the results. It usually would take a number of weeks and usually a number of injections, but some people swear that they feel better already. That's possibly just down to the extra lubrication of the area. Now, in here, when you're coming in for a PRP injection, so say, for example, it was your knee, we would possibly numb it if that's something you wanted to do. And then we would usually do shockwave around the knee as well. Now, the reason we would do that is because we want your body to, like when you fell over and scraped your knee and your body recognised that there was an injury and it sent those healing cells to go and heal that area. That's what we want your body to do. So shockwave causes micro trauma. That is what it's doing. So we would do that first. We would cause some micro trauma around the area to stimulate that healing process. And then we would then put the PRP in. Now, usually for patients, when we're doing that around the knee, we would give them the option of getting a local anaesthetic in as well. Because sometimes what that can do, it can allow us to really go for it with the shockwave. And what that does with our protocol, we find that we're getting pretty good results with that because we're doing the shockwave and then the PRP. Now, usually if you've got something like joint arthritis in your knee, we would recommend 3 injections. And again, this is what the research papers are saying, 2 to 3 injections, anywhere between 2 to 4 weeks apart. So somewhere between 2 to 4 weeks apart, you would get an injection. And generally what patients are finding, based on research, based on what we're seeing just now, is that they're getting a year's worth of, 9 months to a year of pain-reduced movement. So they're able to, I've got one patient just now who's able to return to, I mean, he's away just now. He's actually down south just now, and he's out walking around London, and that's something he's not been able to do in many years. And so it can be quite a nice relief. But again, I want to just be really clear on that. The research on it, there is no clear protocols. There is no absolute clear research. I have just done a lot of digging, a lot of reading, a lot of research to look and create our protocol for that. So for us, you will generally get shockwave with it and your PRP injection at the same time to give it the best possible opportunity to get that healing environment, I suppose, is what we're trying to do. So that is it. The cost, let's talk about that. So the cost is not as expensive as maybe you would think. So you would get that full package with your PRP, get your blood taken, the spinning, your injection. So you would get, your first would be £280. That includes the whole process and the shockwave. And then for your other 2 injections, they would be £200 each. So your whole package would be £680 for 3 joint injections if you're doing the 3 injections. We don't usually sell it as a full big package. We would usually say to you, come for 1 injection. Definitely have a second one as long as you are willing to have a second one. And we would usually see you between 2 to 4 weeks after your first injection and see how you're doing there. Now, I think it's really important to also see here that there's no one thing that will resolve any particular problem. So we're not going to fix osteoarthritis. So let's make that clear. We're not giving you a joint replacement. That isn't what we're doing. This is ideal for people who are possibly delaying surgery for osteoarthritis, or for people who want to maintain, maybe they're maintaining, or they've got some injuries there. They're maybe fairly young, not quite needing a joint replacement, but want to try and avoid that. So that's also great for that. And it's not just for the knee. We can do greater trochanter. So I've got quite a few women over 40 that with greater trochanter pain syndrome, so that kind of lateral hip pain can be great for that, because you've got your trochanteric bursa just sitting here, and they used to call it trochanteric bursitis. It's now, that name doesn't get used. It's greater trochanteric pain syndrome, because it isn't always associated with bursa inflammation. But that can be involved, and it can be really helpful for that as well. It's usually something to do with the tendons in that area, hence why trochanteric bursitis isn't an accurate way of describing that. But a big part of whatever you're doing, no matter if we're doing PRP on you or not here, rehabilitation will be part of this, because what you will find is that your tissues are responding in a way because something you're doing. So we will rectify that and support you through that. Also, if you've got, for example, we'll use knee osteoarthritis with you anyway, we have other ways of offloading. So the use of orthotics, changing in footwear with orthotics can be absolutely life-changing. So these are all part of that management. It's not just a case of you would have PRP and that would resolve everything. It is that full management plan where we're looking at always of basically helping you. So it doesn't matter really what age you are. PRP can be beneficial. If it's something that you're interested in, please do feel free to ask some questions. The first thing you would have to do before we would suggest PRP is book in for an assessment. So that could be a full biomechanical assessment, or it could be an MSK assessment, so where you're just coming in for a particular issue, you just want something looked at, and we may recommend PRP. But again, if you're suffering with pain, inflammation, injuries, then get in touch. It's really not a big deal. It's pretty simple, really. But it just seems really scary. It's a pretty simple process. We're just taking your blood, we're utilising your blood's healing properties, and we're putting those healing properties where your body needs it to be. That is it. So it's pretty minimally invasive. It's great for those of you that don't want to put foreign substances into your body. It's great for those that maybe want to kind of almost think about it like biohacking your body a little bit. So yeah, it's natural. It's not some weird thing that's going in. What more can I say? We're loving it. We love the fact that we have another alternative to things like, so here's like when I've got Austenil here, a couple of different ones. So this is like the Austenil tendon, and this can work great for example, the Achilles tendon. It can, but as a foreign body, it is something foreign going into yourself. And then these are usually little joint injections. So this would usually be for small joints around the feet. So they're great. They're less are these effective as a steroid? I would be using it for a different reason as a steroid. I'm basically just getting that kind of almost like joint fluid in there, and the idea behind that is to reduce the friction, reduce that kind of bone on bone, so that you're then subsequently getting less inflammation. So yeah, it would reduce inflammation based on that. So that's it. If there's any questions, I can see there's quite a few of you there. Please let us know. I'm just checking who's there. There's quite a few of you. Hi, Caroline. Hi, Rebecca. Hi, Gemma. If you're watching this on replay, feel free to ask. We will happy to answer any questions that you do have. But as PRP, it's not as scary as maybe you would think. So platelet-rich plasma injections. I'm going to head off and have a fab Saturday.